My name is Morna Ballantyne, and I'm the Executive Director of Childcare Now, Canada's national childcare advocacy organization, and we are the host of this session. So before we begin, I want to remind you that the webinar is being interpreted so that you can follow in either English or French. So if you want the default, and Zoom is to follow in the what we call the floor language, so that would be English. If you want to follow and receive only English or only French, click on the interpretation icon, which is either visible to you at the bottom of your Zoom screen, or you might find it under Tools, depending on what version of Zoom you have on your system. The slides, the presentation slides that our presenters will be using will appear on the screen in English, but we will be making those available to you through a PDF in the chat, which you can open up if you would prefer to follow the slides in the French language. I'm joining you from Ottawa, which is located on the unceded, unsurrendered territory of the Anishinaabe Algonquin Nation, which is made up of 11 recognized First Nations, 9 in Quebec and 1 in Ontario. Although Childcare Now has its headquarters in Ottawa, our organization, of course, is active on ceded, unceded, contested lands and waters across Turtle Island. I would invite you to introduce yourselves in the chat box, and you can also share your own land acknowledgement through the chat as well. We will not have time, I'm sorry to say, for introductions of all the participants because there are just too many of us. Over the next hour, we are going to be reporting on some of the key activities that Childcare Now undertook as part of our 3-year study of the growth of the Canada-wide early learning and childcare system through its first years. I just want to take a few minutes to provide you with some background and some context. The project was funded in part by Employment and Social Development Canada's Early Learning and Childcare Innovation Program. The work was also supported by hundreds of individuals who donated their time to participate in the many meetings and consultations held over the 3 years. And I want to use this opportunity to give special recognition and thanks to the members of the project's advisory committee. Marnie Flaherty, who during the project was serving as the interim CEO of the Canadian Childcare Federation, Christopher Smith of the Muttart Foundation, Martha Friendly, the ED of the Childcare Resource and Research Unit based in Toronto, and I noticed Martha has joined us for this webinar. Susan Prentice, Duff Roblin Professor of Government at the University of Manitoba. Sandra Menzer, who's an independent childcare consultant based in BC. And Christine McLean, who's Associate Professor at the Child and Youth Study Program at Mount St. Vincent in Halifax. I want to make it clear that although the Government of Canada provided funding for the project, the work was carried out independently of it and independently of any other government. The ideas, the views, and the opinions that are going to be shared today and that we have been sharing through our various published reports don't necessarily reflect those of the Government of Canada. So over the 3 years of the project, we carried out a range of research activities. We tracked the expansion policies, the programs and progress of provincial and territorial governments across the country. We examined approaches to the expansion of not-for-profit and public childcare in a selection of other countries. We conducted in-depth studies of expansion and related childcare policy in 7 Canadian jurisdictions: Newfoundland and Labrador, Nova Scotia, Prince Edward Island, Nunavut, Ontario, Manitoba, and British Columbia. We couldn't visit every jurisdiction in Canada, but we chose 7, and we think that they together are representative of what is going on across the country. We commissioned research from housing experts as part of this project to identify what the childcare sector can learn from the nonprofit and public housing sector about growth and sustainability, and also to identify some successful examples of co-locating childcare in housing developments. And we zeroed in and reported on some additional and specific aspects of growth, including growth in family home childcare, the design of quality childcare facilities, modular builds, and the state of public delivery of childcare in Canada. So all this work is reported in various ways on our website, childcarenow.ca, and you can find the project reports if you want to go directly to that section on the website. That's at childcarenow.ca/growth-by-design, because our project name is Growth by Design. This webinar is only going to cover just a fraction of what we learned through the project. But today we're going to hear presentations, first from Liz Adamson, who's Childcare Now's Research and Policy Coordinator, who was assigned to this project, and we're going to hear from Jane Beach, the project lead. I'm not going to take time to review their very impressive resumes. These are summarized on our project website. But be assured, and I'm sure you probably know this, that both are published experts in childcare policy. And they have a very sound and long reputation as being thorough and thoughtful researchers. Liz is going to provide an overview of the space creation that's been achieved so far under CWELCC. And then Jane is going to report on the lessons learned about expansion of the not-for-profit and public childcare sectors through our 7 jurisdiction case studies. These case studies involved, of course, visits to each of the 7 jurisdictions, meetings with provincial, territorial, municipal, and school board or school district officials. And in the case of Manitoba, we met with the Minister of Education. Focus groups were held with licensed childcare center operators and family home childcare agencies, including, and we also included in focus groups commercial operators. Sometimes we met with together, not-for-profit, commercial, and sometimes separately. Meetings with Indigenous childcare organizations and operators also took place, as did meetings with Francophone organizations and operators. We held focus groups with early childhood educators and early childhood educator organizations. We carried out many visits to new or renovated centers, and we held meetings with parents and advocacy groups. So through the presentations, the 2 presentations, I want to encourage you to put in the chat box your questions, your comments, your reactions to what's being presented. And after their presentation, I'm going to do my best to synthesize your questions or observations and ask Jane and Liz to respond. So with that, I turn it over to Liz for the first presentation. Thank you, Liz.
Thank you, Morna, for the introducing the project and a bit about what Jane and I will speak about. I'll just share my slides here. Make sure I can see everything properly. Everyone can see that okay? Great. So, as Morna indicated, I'm going to talk a little bit about some of the data that we looked at and analyzed. So to start with, I'll just tell you about where the data comes from and how we used it. So in this presentation, we focus on the expansion of licensed spaces for 0 to 5-year-olds who are not attending school. We are presenting a snapshot of the findings from our recently published report, the growth report that we've called it, that is tracking the expansion of licensed childcare in the first phase of CWELCC. The data presented comes primarily from the Childcare Licensing and Accessibility by Region database, or CLAR, which was developed by David McDonald and his colleagues at the Canadian Centre for Policy Alternatives. The database is updated approximately every 6 months, and it basically scrapes data from the licensing data from the provinces. It breaks down the data by age group: infants, toddlers, preschool age, both full day and part day, kindergarten age, and school age. There's also an occasional care category, which we've added into the full day preschool for the purpose of this analysis. And so for this presentation, we are excluding school age and kindergarten spaces, even though in some provinces they may be for 4 and 5-year-olds. In the growth report, we talk a little bit more about that age group in the provinces where it makes a big difference, for example, in Ontario. But I don't touch on that in today's presentation. So CLAR includes all licensed spaces regardless of whether or not they are funded. And at the same time, it does not include funded spaces that are unlicensed. So the implications of this are mostly relevant for school age care, but that's not necessarily the focus of this presentation, but it's one of the reasons why we haven't included school age care in this analysis. It's also important to note that in CLAR, it currently does not include the 3 territories, only the 10 provinces. It is expected, though, that future analysis will allow this as the updates occur over the next 6 months and year. As well, the methodology for family childcare in the CLAR database is based on an estimate of capacity. So instead of using this estimate, which can be a bit not necessarily as accurate in some provinces, the data for family childcare in this presentation is drawn from the Childcare Resource and Research Unit's ECEC in Canada series. It's also important to note that for CWELCC data, so when I get to that slide, that data is not available for Alberta, so it's not included in those Canada-wide summaries. So you can see the slide there. Those are the 5 kind of areas that I'll touch on over the next 15 minutes. So a few high-level trends that we found. There's been strong overall growth. Canada, when I say that, I'm referring to the 10 provinces, added more than 111,000 spaces for children aged 0 to 5 between 2022 and 2025, which represented approximately a 16% increase over this 3-year period. There's been expansion across all hospice types. Although the public, not-for-profit, and for-profit sectors have all expanded, approximately 2/3 of new spaces for children for 0 to 5 is in the for-profit sector. Participation in CWELCC is high, but it's uneven in some provinces across hospice types. Schools remain a central focus for expansion, with approximately 14% of licensed spaces for 0 to 5-year-olds located in schools. And in the past 3 years, from 2022 to 2025, approximately 600 new additional school-based facilities opened. And lastly, family childcare is increasing. Regulated family childcare grew by more than 34,000 spaces across the provinces and territories, from 7.9% to 8.7% of all regulated spaces. So the next slide is a quick snapshot of these numbers broken down by age. So across Canada, the number of licensed spaces for children 0 to 5 increased from over 674,000 to over 785,000, representing over 111,000 new spaces over this period. And as you can see, there's been increases in all age group types, with the exception of part-day preschool. Changes in the auspice of licensed childcare spaces can also be tracked over this period. The pie chart on the slide shows the distribution of the net growth by auspice. So of the 111,656 net spaces created, 66.7%, or approximately almost exactly 2/3, were in the for-profit sector, and approximately 1/3, 32.2%, were in the not-for-profit sector, and 1% in the public sector. So that is the distribution of net growth. So this pattern of growth resulted in a 2% increase in the share of for-profit spaces between 2022 and 2025, increasing from 52.7% to 54.8% of all 0 to 5 licensed spaces. This next slide is looking at provincial breakdowns in the 2 years, 2022 and 2025. As you can see, the scale of expansion varied, reflecting differences in population size and baseline capacity. Although I know this figure is a little bit blurry in the way I've tried to make it big enough on the screen, but it does help to illustrate the scale of expansion in each of the provinces. I'll just leave that there for a minute, and then the next slide has a lot of numbers on it, so I'll try to go through it slowly that you can digest or focus in on the provinces that you might be more interested in. So this next slide shows that the balance of expansion across public, not-for-profit, or for-profit sectors differs considerably by province. These differences are important as they indicate whether provincial expansion strategies are reinforcing or shifting the balance of service delivery across auspice. The table shows both the total increase and the distribution of net growth by auspice. So the three columns on the left show the net growth in spaces in each of the auspice types: public, not-for-profit, and for-profit. And then the total net change is the sum of those first three left columns. And then the right three columns shows that of that growth, how much was public, how much was not-for-profit, and how much was for-profit. So Nova Scotia stands out as the only province in which both the number and the share of full and part day spaces for 0 to 5-year-olds increased in the not-for-profit sector, with no expansion in the for-profit sector. A quick summary, if you can look through the column to see that if we look at the not-for-profit column, all of those over 50% are those that had, the majority or most growth was in the not-for-profit sector. If we look at the right column, all those over 50%, so Prince Edward Island, New Brunswick, Ontario, Alberta, and British Columbia, in all of those provinces, the majority or most growth was in the for-profit sector. So although the number, we use these numbers in the table, along with some others, to calculate the changes in the share of not-for-profit versus for-profit spaces in 2022 and 2025. So I'll just highlight a couple of those provinces that kind of stood out as showing a big shift in the share that were for-profit in those 2 years. So in Newfoundland and Labrador, the share of not-for-profit spaces for 0 to 5-year-olds increased substantially from 22.6% to 31.5%, while the share of for-profit spaces declined by about the equivalent amount, about 8%. By contrast, in Alberta and British Columbia, there was increases in the share of for-profit 0 to 5 spaces. In Alberta, the proportion rose from 69% to 74.8%. In British Columbia, the for-profit share increased from 60.7% to 64%, just over 3 percentage points, with corresponding decreases in the not-for-profit spaces. Next, we'll look quickly at CWELCC status. Although there isn't a lot of, the numbers here are fairly similar across most of the provinces, with just 1 or 2 provinces kind of looking a little bit different. So which is why I haven't shown any figures, because it's fairly standard across the table, above 95%, with the exception of Ontario. So a central objective of the CWELCC agreements is to expand the number of licensed and affordable childcare spaces across the country. It's therefore essential to track not only overall growth in licensed spaces, but also whether new and existing spaces are operating within the CWELCC funded system. Across provinces, there are a range of reasons why a centre may not participate in CWELCC. Some operators may choose to opt out, while others may not have been approved for funding under provincial allocation processes. In Ontario, for example, service system managers are responsible for allocating CWELCC spaces and funding based on provincial targets and directed growth strategies. As a result, some centres may not be approved for CWELCC funding if the province has not allocated sufficient CWELCC spaces to that service area. The distribution therefore reflects both differences in provincial eligibility rules and variations in operator participation. Next, I'll talk a little bit about school-based childcare. I'm going to touch both on Very briefly on school age childcare and where that fits into this, and then focus the next slide on 0 to 5. So as I mentioned, because one of the reasons that this presentation and the report is focused on 0 to 5 spaces is because the availability of school age spaces in the CLAR database is limited in 2022. So we couldn't accurately calculate the increase in spaces to 2025. There is 2025 data, but we couldn't measure the change accurately in all the provinces. But we do know that there's been approximately 600 new school-based facilities, and many which do serve only school-age children. The figure in the slide here shows that of the 6 provinces that we do have school-age space data for in 2022 and 2025, the majority are school-age spaces. Approximately 72% of all licensed spaces in schools are school age in 2025. And those 6 provinces are Newfoundland and Labrador, Nova Scotia, Ontario, Manitoba, Alberta, and BC. Looking at it another way, 70% of new licensed spaces in schools in that time period were school-age spaces. However, the next slide will ignore those school-age spaces in that figure there, and we're adding in the rest of the 4 provinces and looking at the 10 provinces for 0 to 5 spaces. So in this figure, you can see that there's been a net increase of almost 11,000 spaces for 0 to 5-year-olds located in schools. And what's notable about this is that we saw in the pie chart that 2/3 of spaces for 0 to 5-year-olds were in the for-profit sector. However, in school, if we look only at school-based spaces, most of the growth, or 80%, was in the not-for-profit and public sector. Next, here's a quick summary or overview of the growth in family childcare. So while center-based expansion has received the most attention under CWELCC, these data show that family childcare has also grown nationally, though it continues to represent a relatively small portion of the overall regulated system. It has, though, increased. Family childcare spaces represented 7.9% of all regulated space in 2021, rising modestly to 8.7% in 2025. And just as a reminder, this data here comes from the Childcare Resource and Research Unit's ECEC in Canada series and does include the territories. So this is all 13 provinces and territories. It is important to interpret these increases cautiously because the growth in regulated family childcare spaces may reflect previously unregulated, or in some cases, previously unregulated providers becoming licensed rather than new providers entering the sector. So what can we learn from all of this? I know it is a lot to digest, and we will share the slides, and the report has some more description and detail, which is available on the website. But we can see from this that provincial policy choices are shaping the emerging system. The central finding of the analysis is that significant variation across provinces. Jurisdictions differ widely in their expansion strategies, the balance between not-for-profit and for-profit provision, the role of school-based programs, and the extent to which family childcare is being supported. These differences highlight the decentralized nature of Canada's ELCC system. While CWELCC has established a national framework and common objectives, provincial policies and planning decisions continue to play a central role in determining how expansion unfolds in practice. So looking ahead, the rapid expansion of licensed capacity between 2022 and 2025 represents an important first phase in the development of Canada's emerging ELCC system. However, meeting the long-term goals of affordability, accessibility, quality, and expansion, primarily in the not-for-profit and public sectors, will require continued attention to several key issues, including workforce supply, the balance of public and not-for-profit provision, and the alignment of expansion strategies with community needs. Ongoing monitoring of system growth will be essential to assess whether current trends are moving the system towards greater equity and sustainability. So thank you very much, and Jane will touch on some of these themes further in her presentation.
Thanks so much, Liz, and thanks for all the work that you did on this project. We really appreciate it. And please, if questions came up for you during the presentation, uh, just put them in the chat and we'll get to them after Jane's presentation. So Jane, over to you.
Thanks, Morna, and hello, everybody. It's a pleasure to be with you today. I just want to make sure that you're seeing my slides in presenter mode. Yes, okay, thanks. So as we all know, over the
They're
past
not showing up on my
Oh,
screen.
darn
So
it. They're not.
did somebody else just say the yes?
I'm not seeing them yet either.
Oh, okay, hang
Okay,
on.
just take a breath and
Yeah,
just
right.
share again.
Screen 2, share.
There we go.
Slideshow. Are you seeing them now?
Yes,
There
we
go.
are.
Yeah.
Oh,
Thank you so much.
thank you for, otherwise I would have just barreled right ahead. So hello again, everybody, and it's great to be here with you today. So as we all know, over the past 5 years, Canada has made the largest public investment in early learning and childcare in history. And we received some good news last week. I think Morna mentioned it was on Friday that new federal funds have been announced. Even if they are only for 2 years, it's a significant step forward. And as Liz mentioned, thousands of new spaces have been created, and we know that parent fees have fallen significantly, and governments across the country have been working to lay the foundation for a stronger publicly funded system. So, what have we learned about how to build a stronger, more equitable, and more sustainable system? Addressing that question is really at the heart of the case studies. So over the past 3 years, we examined how public and nonprofit childcare expansion is unfolding in the 7 jurisdictions that Morna mentioned. And our goal wasn't to identify a single best model, but rather to understand what is helping expansion succeed, what barriers remain, and what lessons can inform the next phase of policy development. So given the time available today, I won't be able to cover every jurisdiction in any detail. So we really hope that you'll explore the individual case studies and spotlight papers on the Childcare Now website, which I understand Morna has linked in the chat. So instead, I'd like to focus on the common themes that emerged across the case studies and what they suggest about the future of childcare expansion in Canada. Before I turn to those themes, it's worth recognizing one overarching achievement to date. And across every province and territory, parent fees have been substantially reduced for most families accessing funded spaces. That has been transformational for many parents. At the same time, the case studies identified important questions about equity, equitable access, affordability, and quality that remain unresolved. And I'll return to those later in the presentation. And I would just like to add that over the course of the 3 years, we've noted that many priorities, new programs, capital funding that were in place at the beginning of the study have changed or are no longer there. So it's been quite challenging to keep up to date on what's going on around the country. So several common themes emerged consistently across the 7 jurisdictions, regardless of what the province was doing, what their approach was, what programs they introduced and implemented, and what kind of funding was available. So on the left-hand side of this slide, the more positive themes that emerged is that workforce compensation has improved in most provinces and territories, whether it's through wage grids, wage enhancements, and in some jurisdictions, pension plans and province-wide benefits. Secondly, we observed in many jurisdictions increased involvement of different public entities in childcare expansion. So outside of Ontario, where local governments have a mandated role to manage childcare, school boards, municipalities, Indigenous governments, and public institutions are taking on larger roles, whether it be in planning, development, and in some cases, operation. So from hamlets and district education authorities in Nunavut to rural municipalities in Nova Scotia, PEI in Manitoba, to school districts in BC and Ontario. Local governments and entities are taking on new roles, and they can play a really important role in identifying need, securing land, managing capital projects, and ensuring equitable access. And we found that jurisdictions with stronger public planning mechanisms appeared better positioned to expand services more strategically. As Liz already mentioned, there's been a significant increase in spaces for all age groups, including unfunded school age or unfunded through CWELCC school age spaces. And across Canada shows the first significant increase in family childcare spaces since 2012. So that's what, 14 years. We have also observed that modular construction, especially when it's built on public land, such as school grounds, allows for rapid expansion and minimal disruption to the surrounding environment. That's not happening in every jurisdiction, but where it is happening, it was quite notable. At the same time, important challenges remain. So on the right-hand side of this slide are some of the common issues that operators consistently raised. So despite the improvements to wages through enhancements and wage grids, workforce shortages remain the single greatest barrier to expansion and to quality. Every jurisdiction identified recruitment and retention challenges as a major concern, and operators frequently reported having an approved expansion project but insufficient staff, and so they weren't able to open or operate at full capacity. Expansion is still largely driven by local initiative and capacity. It's really up to individual organizations, whether for-profit or not-for-profit, to come forward and decide that they're going to open a childcare center. And many of the nonprofits that we met with remained hesitant to expand because of concerns about long-term operating sustainability and the risks that they have to take on when long-term funding isn't certain. And with capital projects, quite often construction costs escalated from the time a project is submitted and when it's approved, which can take several months. And then the onus is often on that organization to come up with a shortfall. Public funding continues to support growth in both the not-for-profit and for-profit sectors in most jurisdictions, as we saw in Liz's presentation, and more than half of the new spaces have been in the for-profit sector. And significant equity issues remain unresolved. This is particularly the case in rural, remote, Indigenous, and underserved communities, as well as for children with additional support needs. But there's also an equity question about fees and fee reductions. So even though they've fallen dramatically, they're not applied in the same way across the country. So in some jurisdictions, for example, in PEI and New Brunswick, children who are under 6 but in kindergarten, those programs are not eligible for CWELCC funding. In some jurisdictions where school-age childcare, including kindergarten spaces, don't have to be licensed if they're in a school, aren't eligible for CWELCC funding, and those are usually still charging market fees. So there's still a lot around fees to address. I think one of our strongest lessons from the project is that public planning in itself matters more than any individual expansion strategy. So across the country, there have been capital grants, public-private partnerships, and other expansion mechanisms. And while these are all really useful, they're not substitutes for planning. So jurisdictions that demonstrated the greatest capacity for strategic expansion generally had stronger public leadership and planning mechanisms in place. And public entities such as municipalities, school boards, Indigenous governments, and other public bodies can really help identify need, secure land, coordinate capital projects, and promote more equitable access. What we consistently found was that workforce, capital, public land, modular construction, school partnerships, and Indigenous partnerships, these are not isolated issues. They all work better when they're part of a publicly planned system. For example, one of Ontario's most significant contributions to the childcare discussion around expansion is the role of the system service managers, or primarily municipalities. While not without their challenges, they do provide a formal mechanism for local planning and coordination that many other provinces lack. And their experience demonstrates that expansion is strongest when there is dedicated local leadership focused on assessing need, coordinating partners, and directing growth towards underserved communities. BC also demonstrated that the important role that Indigenous organizations can play as system builders, supporting workforce development, planning, capital expansion, and culturally grounded services across multiple communities. What we found in many jurisdictions is that expansion remains largely reactive and market-driven. So few provincial or territorial governments actively steer where growth occurs. As a result, access often depends on the willingness and capacity of individual providers to expand rather than on systemic planning based on community need. So even in Ontario, where there are directed growth plans allocating spaces to particular local governments, how those spaces are going to expand, again, it's really up to individual organizations and childcare operators to come forward. So the case studies highlighted several examples of how public infrastructure can support expansion. Notably in BC and Ontario, school boards are increasingly playing a role in childcare planning and development. School sites provide access to land, to infrastructure, and to opportunities to integrate childcare into broader community planning. Some, not many, but some are directly operating childcare, usually, but not always, for school-age spaces. New legislation is expanding the role of school boards in providing childcare, and integration with schools creates opportunities for long-term planning and for efficient use of public assets. In Prince Edward Island, the municipality of Kincora, a small rural municipality of, I think it's 388 people, demonstrated how even such a small municipality can successfully establish and operate childcare as a community service. We also saw examples of partnerships with community housing organizations and with public landowners. Finally, Manitoba's Ready to Move initiative, while certainly not without considerable challenges, demonstrated the potential of modular and standardized construction approaches to accelerate development timelines and reduce the burden on individual operators. Modular construction is also taking place in parts of BC and Ontario in particular, usually on public lands and often on school grounds. While it's not necessarily cheaper than bricks and mortar, the centers can be built in a few months. So the broader lesson is that public infrastructure provides opportunities that individual providers often cannot access on their own. However, at the moment, other than the mandated role for local government in Ontario, whether it's a school district, a municipality, or some other public entity stepping up, it's really up to that local entity to come forward, and it's not part of a larger provincial territorial plan for them to play a greater role. So a common misconception we found is that expansion is primarily a capital funding challenge, and the case studies really suggested otherwise. So creating new spaces, it often, obviously does require adequate capital funding, excuse me, but it also requires sustainable operating funding, including for workforce compensation, for project management capacity, and also to recognize that centers need startup funding and that they do not open at full capacity. And that's often not recognized in funding, and that shortfall falls on the shoulders of the operator. Community organizations need access to land and facilities. Operators describe to us numerous barriers, including rising construction costs, complex licensing processes, challenging securing sites, and limited development expertise that they had. We also heard concerns and we observed our concerns about the physical design of some new spaces. Some jurisdictions have developed design guidelines, but they often fund only to the minimum requirements rather than to high quality environments designed specifically for children and educators. In our travels, we saw some new centers often costing millions being built with poor layout and design and what appeared to be little thought as to the experience for children and staff in those spaces. So the lesson here is that physical expansion depends on an entire ecosystem of supports, not simply a capital grant. And of note, both Nova Scotia and BC released comprehensive design guidelines, in our opinion, that are really excellent in the past couple of years, but the available capital funding did not allow for centers to be built to those specifications. If there was one issue that was raised consistently in every jurisdiction, it was around workforce shortages. So despite wage increases and new benefits in several provinces and territories, recruitment and retention challenges persist. Operators repeatedly reported that they had approved expansion projects but couldn't operate at full capacity because they couldn't recruit enough qualified staff. And while the challenges are particularly acute in rural and remote areas, they're fairly acute everywhere. And several jurisdictions raise concerns about balancing rapid workforce growth and the need for, the growth to match expansion with maintaining quality and also providing appropriate mentorship for new educators. So ultimately, workforce remains the foundation of expansion. And without sufficient numbers of qualified and well-supported educators, it will be difficult to achieve expansion targets, regardless of the level of capital investment. And the issue is no longer simply wages. Increasingly, workforce challenges are linked to housing affordability, immigration policy, training capacity, and school age compensation, where generally school age staff are not covered under CWELCC funding or provincial territorial wage grants. So based on the case studies, several priorities emerged in our view for the next phase of expansion. And here are just a few of the recommendations that we propose going forward. So first of all, government needs stronger public accountability mechanisms in place regarding expansion planning and outcomes. There don't actually seem to be any real expansion plans beyond a target number of spaces, not how they will get developed and who will operate them. Second, capital expenditures should be linked to clear planning objectives and subject to strong oversight. There's been concern in some instances that construction costs are being inflated since they're being often publicly funded, and developers and landlords are making significant profits when not-for-profit operators get grants for capital improvements and then are charged by the landlords and developers huge rents. We've also seen recent news stories about publicly funded centers only being able to be insured at half the building cost, suggesting that the costs were significantly inflated. There is little public reporting and little public engagement. It's often difficult to get information about policy and funding changes and how decisions are being made. Future growth really needs to prioritize public and not-for-profit delivery, even though all of the CWELCC agreements with provinces and territories state that priority should be for public and not-for-profit growth. That clearly isn't happening in many jurisdictions, and we're seeing significant public dollars supporting private profits, largely due to the lack of public planning and real transformational change. So governments need to continue investing not only in childcare spaces, but also in the public and social infrastructure that supports expansion. And finally, better data systems are needed to support planning, to identify unmet need, and to evaluate progress. So just to wrap up, there are some questions that we think governments in particular, but the childcare sector could engage in discussions of this nature. There are some questions that really need a lot more discussion to address. So first of all, what kinds of public planning and shared responsibility are needed to strengthen not-for-profit expansion? How can quality be maintained while governments continue to pursue their ambitious expansion targets when there's such workforce shortages? And should governments take a more direct role with the workforce in addressing compensation? None of the wage scales have been negotiated with the sector. Should that be taking place, and would that help with retention of early childhood educators? How can municipalities, school boards, and other public entities be encouraged, or can they be required to play a larger role? Because we've seen much bigger success when they're involved. And how can governments balance public and not-for-profit delivery in ways that strengthen the overall system? Some nonprofit agencies told us they thought that public entities had an unfair advantage as public sector wages were higher than what many not-for-profits can pay, and they have a whole infrastructure to support their operation. So if higher wages are the reason, and if there were better wage scales that applied to everybody, would that make a difference? And would that encourage more municipalities and school districts to become direct operators of childcare? And these are all questions that will shape the next phase of childcare development in Canada. I think the biggest lesson from Growth by Design is that we're not simply building childcare spaces. We need to build the institutions that plan, coordinate, support, and sustain expansion over the long term. And the case studies show that there are many promising practices across the country. The challenge now is to build on those lessons and move towards a more planned, equitable, and sustainable system of public and not-for-profit early learning and childcare. So thank you very much, and we look forward to your questions and comments.
Thanks, Jane, and thank you also for leading this project and doing such a tremendous job. It was a huge amount of work over a long period of time, and so we're very grateful for all of your efforts.
Yeah.
There aren't actually many questions. Some of them in the chat, some of them have been answered already in the chat. But there was an interesting question I thought raised in the 2 p.m. Version of this webinar. This is our second time today where we're providing and sharing this information. And it was a question from Rita Chudnovsky, and she said, so what really surprised you? Did you learn anything over the 3 years that was unexpected? And Liz, I invite you to comment as well. Jane, what do you say to that?
Well, there were lots of small surprises in individual jurisdictions, things like in Nunavut, the challenges of building childcare in such remote communities where you can't get supplies except for maybe once a year on a ship, and where you're building on permafrost. At a big picture level, I think I was really surprised at, regardless of what provinces and territories are doing, the issues that people face and identified to us were similar, no matter what jurisdiction they were in. I think that was the biggest surprise for me. I was also surprised at the growth in the public delivery, that even though it's still very small, I was surprised at how much there actually is, especially in BC. And even though we didn't do a case study in Alberta, there's a lot more than I expected. So Liz, I'll turn that over to you now.
Thanks, Jane. Yeah, as I mentioned in the previous webinar, I think from a data perspective, one of the surprising trends for me was the increase of school-age childcare, where even where there was, mostly emphasis on CWELCC. And of course that does, I think we have to remember Ontario when we look at those numbers, because it is such a big province, and a lot of those spaces are kindergarten spaces, and they are being funded by CWELCC. And that just to note that wasn't part of the presentation, but it's an important part of the growth. And in other provinces as well, there's a lot of school age expansion. The other, although I didn't go on all the case study visits with Shane and Warner, I did get to go to a few of the focus groups and consultations and meetings in Ontario. And I think what struck me was hearing from operators about how much, both small and large ones, how much they took on in terms of financial risk and regulatory risk, and how much they had to do that I kind of had to kind of not assumed, but you would think that local governments were doing more of this planning, or provincial governments doing more of this planning around finding land and that sort of thing. And I just think I was thinking about this one individual that she, as even herself, was taking on this huge risk in trying to fund it financially. Obviously, not her funding it, but the risk was held by her as the executive director of a little organization, and that just kind of stuck with me and reinforced Jane's recommendations around the need for more local planning and responsibility.
Thanks, Liz. So a couple of questions have just popped up. I just wanted, one of them is around workforce. Jane, you said, and what you said is exactly what we heard everywhere, that workforce challenges were a barrier to expansion, and even a barrier to actually using existing license capacity. So we've done Childcare Now has done another project that addresses workforce issues, and I've put the link in the chat to the reports generated from that project. The question is, so just from your observations, what do you think has worked to address workforce challenges briefly? What's worked best with respect to workforce?
Well, I think when if there's any type of workforce strategy, that definitely makes a difference. And they're few and far between, though they have taken place in PEI is one place that stands out where there was a workforce strategy. I do think having wage scales does make a difference, having pension plans. I think Nova Scotia really speaks to that with their defined benefit pension plan. Having access to no-cost training. Some provinces have waived fees for early childhood educators and have also made different models of access to education. So workplace training models of that kind. So people who may be working in the sector and without adequate credentials can continue to be employed and receive that. One thing that we heard a lot about that isn't happening but does make a difference where it does is kind of mentorship and support and proper onboarding of new staff. We often heard from staff who were just like thrown into the job. Okay, you're breathing, you're hired, without any real orientation and support. And so when that is available, when people really understand what their scope of work is, what their work environment is like, makes a difference. If staff have things like a staff room, that came up quite a bit, and where we saw in new centers a staff room that maybe could hold 2 people, and then that space would be taken over to add a few more childcare spaces. So it's not just wages and not just wages, but working conditions and working environment, makes a difference. But I think we really need a federal workforce strategy that all provinces buy into and territories buy into. And everybody should go look at your other project because there's a ton of fantastic materials that have been produced from that project.
Great. Another question, Liz, you might be able to answer this one. Jane, you too, but Liz, I'll turn to you on this. The question is, did we track where the expansion is happening geographically? Do we know if the expansion is taking place in, for example, low-income communities? And to what extent is the expansion meeting identified needs? So is the growth happening to actually respond to the biggest gaps between supply and demand. We have provincial jurisdiction breakdowns. We have breakdowns by auspice. Can you comment on that?
I can very briefly comment on it, but not necessarily answer the question in that the data available in CLAR could do this because it has centers and spaces by postcode, per postal code. It's not something that was done in this analysis. And I think it would probably involve a bit of a multi-method approach to then looking at the case study data and seeing what operators in certain regions were saying about need and demand and supply, and kind of looking at that. And but it wasn't something we looked at specifically. I did just add that report from CCPA that came out last year on childcare deserts, which addresses that question a little bit, though.
I think we have time for a few minutes more. Jane, I'm reminded, but this question reminds me of our visit to the region of Waterloo, and where we met with with an operator of a new center. It was an operator who operated one center in one place and was invited to open up a second, receive funding, and it met the region's requirement to locate a childcare center in an underserved community. But in fact, the parents and the children who ended up enrolling in the center were not actually from that community, because there's no requirement to be living within a certain, within proximity of the new center. And there was no public transportation to the center. And so what turned out is that it seemed that higher income families who could afford to drive to the center, which was sort of in the outskirts, filled the spaces. And they actually were not able, and in that region, there is a requirement that centers have 30% of the spaces are filled with families who have low enough income to receive subsidy, but they weren't able to meet that criteria. Jane, do you want to comment on that?
Yeah, and I think that is, while I think having the directed growth plans, identifying communities that are underserved and where there are low-income families is very useful, but you're quite right that it doesn't address who, there's no data, I don't believe, on who is actually using these spaces. There's, income data on the communities in which childcare is created and where it is, and the CLAR database, as Liz mentioned, can do that. But at the moment, there's no, we don't have information on who is accessing these spaces. And that is really problematic, because those with the greater resources, no matter where the centers are built, will often use those spaces. The other thing that we heard in Ontario, not in Waterloo, but from the provincial government, is that there are a number of for-profit centers that are opening in high-income neighborhoods and choosing not to get funding from CWELCC because there is such a demand. And in those communities, parents are willing to pay $2,000 or $3,000 a month, for complete market care. And that's quite concerning as well.
And we are at the hour, but if you could just take 30 seconds to just answer this question, and that's around coverage. Do we know if the expansion of licensed childcare is actually creating new opportunities for families who have no access to childcare, including informal arrangements? We don't really have an answer to that. The question is, are families who have access to no childcare, even unregulated, unlicensed childcare, are they getting the spaces or not? But we don't have that data. We have no way of knowing that. Yeah.
No.
Okay, that's the end of the webinar. Thank you again to our presenters. Thanks to all of you for participating. And as I said, we will be sending out the slides. We'll be sending out a recording of the webinar. It'll be posted on our website. And I encourage you to see the reports. They're all available, as almost all, I think, are available as PDFs that can be downloaded and circulated. We really hope that this information will be widely shared. We really hope that governments will pay attention to the results of this study. So thanks and have a wonderful evening.